probably should dye that out right now. Atta girl. Come on, let's go to class.
Start out, lung cancer is the uncontrolled growth of abnormal cells in one or both lungs. And we have a diagram of the lungs, so I'm going to point out the specific anatomy of each lung. For your right lung, you have 3 lobes, and what's separating those lobes are fissures. And the top lobe is called the superior lobe, and the middle lobe is the middle, and the bottom lobe is the inferior lobe. And the left lung only has 2 lobes, so it's just a superior and inferior. And then we have the trachea, which bifurcates into 2 primary bronchi, and then each primary bronchi go into secondary bronchi. And in the right lung, we have 3 secondary bronchi, and 1 goes to each lobe of the lung, and in the left, there's only 2. And then after the secondary bronchi, you have your bronchioles, and those are smaller ones that go to each lobe, and then your bronchioles go into your terminals. And then at the very end of them are the alveoli, and those are air-filled cells.
Symptoms of lung cancer. Symptoms related to your chest are coughing, chest pain can be in your back and down your arm, shortness of breath, change in color or the volume and amount of spit coming up when you're coughing, changes in your voice, sounds whenever you're breathing, coughing up blood. But you can also have symptoms that are not in your chest. You could have loss of appetite and unexplained weight loss, headaches, fatigue, bone fractures not related to an injury, neck or facial swelling, weakness, bleeding, and blood clots. Testing that would be done to identify lung cancer could be an X-ray. Sometimes it doesn't show up on an X-ray, and they can do a CT scan, which would be able to show lesions in your lungs that wouldn't be detected on an X-ray. They can also take a tissue sample, which would be like a biopsy. That would show abnormal cells in your lungs.
Ways to treat lung cancer is surgery, chemotherapy, or radiation therapy. During surgery, a segmental resection will remove a large portion of the lung, but not the entire lobe. A lobectomy will remove the entire lobe of one lung. If you undergo surgery, your surgeon may also remove lymph nodes from your chest in order to check them for other cancer. Chemotherapy uses drugs to kill cancer. It is often used after surgery to kill any cancer cells that remain in your lungs. Radiation therapy also uses high-powered energy beams such as X-rays to kill cancer cells. Radiation therapy can be directed at your lungs from outside of your body. Survival rates for lung cancer is relatively lower than most other cancers, with an overall 5-year survival rate for lung cancer of about 17% compared to 67% for colon, 90% for breast, 81% for bladder, and 99% for prostate cancer.